there. I'm going to be doing your abdominal examination. I apologize. My husband's out of town for a work trip, so I had to use my daughter and my other daughter to film. So, first thing I'm going to do is I'm going to inspect the abdomen. I'm looking for distension, hematomas, enlarged veins, stretch marks, and I'm going to kind of divide the abdomen into 9 sections when I inspect. So the next thing I'm going to do is I'm going to observe for paralysis and pulsations. The reason I look for that is to just kind of rule out any I'm looking for wave-like contractions, kind of to follow the way of digestion. And then paralysis also occurs in the esophagus, stomach, and intestines, and it should follow the movement of digestion. So the next thing I do is I'm going to osculate the abdomen, listen to the quadrants. So I'm going to listen. I want to make sure that we don't have any like hyperactive, because that could indicate excess gas. Then I'm going to listen for a minute on each side in all 4 quadrants. Okay. I'm going to osculate the brute over the aorta. Okay, make sure you're getting the abdomen. And then I'm going to do the renal arteries, listening for a brute. The iliac arteries on both sides. And the femoral arteries as well. And then, so before I percuss, I want to palpate. Or I want to listen just because, sometimes if you press, then you can change like sounds of the digestion. So I'm going to kind of feel lightly. Or actually I'm going to percuss. And then up top here we should have resonate, medium, in the middle here dull sounds, and then lower again some resonate sounds. Solid organs or fluid leads to dull sounds, and a hollow air leads to resonate sounds such as tympanic. So the next thing I'm going to do is I'm going to palpate. I'm going to I'm going to do lightly first, and then I'm going to feel for any masses or abnormalities. And then I'm going to go deeper. I'm going to kind of watch the patient's face too, if there's any response for pain, their indication of pain. All right. So we're going to do the rebound tenderness. So what I'm going to do is I'm going to just kind of press down on the patient, and when I release, I'm going to go about 3 to 4 centimeters in. When I release, I'm going to see if the patient has any grimace that would indicate any pain. So I'm going to, did you have any pain when I released?
No, I'm just hungry.
The Murphy sign, I'm going to push on the upper right quadrant. Can I have you take a deep breath? Good. And if there's any pain associated with that, it could indicate gallbladder disease. I'm going to listen to the Rovzig sign. So I'm going to palpitate the lower left abdomen. And I'm going to kind of see, do you have any pain on this side when I press over here? Okay, good. If the patient did, it could indicate that the appendix is inflamed. Passoa sign is another way to indicate if the appendix is inflamed. So I'm going to have you lay your leg out and bend your knee for me. I'm going to pull it towards me. If the patient experiences any pain, that could indicate that the appendix is involved. The arbitrator sign is another way to look. So I'm going to have the patient put their leg out and then bend their knees at 90 degrees. Any pain? Okay, can you roll on your left side here? Yeah.
This?
Yep. And then I'm going to have you put your leg out like this. Is there any pain in this area?
No.
Okay, because that's another sign to check for appendicitis.
What's that?
The little appendix in your body gets inflamed. Okay. And then the cutaneous hyperthesia. So that just means that the patient's extra sensitive and their senses are on high alert. So if I do any like soft touch, that would be extreme to the patient. So does my soft touches make you feel like it's like intense or just normal?
No. Wait. What do you mean by normal?
Good question. Like, just feel like if I came up and brushed your skin.
Yeah.
Okay, good. But it doesn't feel like, oh my gosh, that's so intense.
No.
Okay, good.
Okay, I'm good.
Okay, good. All right, I'm gonna percuss the liver. Gonna listen to see if there's any abnormalities or abnormal sounds. I'm gonna palpate the liver. Looking, is there any pain when I press here? Good. All right, so we're gonna move over to the spleen. I'm gonna percuss the spleen. And I'm gonna palpate. Any pain at all?
It just tickles.
Okay. So I'm gonna kind of feel for the kidneys here. Well, I'll just palpate first, and then I'll percuss. Any pain or pressure when I push on there?
It tickles.
Okay, good. Then I want to palpate the aorta. Any pain or pressure? If I did feel some pain or pressure in the liver, spleen, or kidneys or the aorta, I would definitely want to do further testing. Especially these sites are, the top ones are, if there's any abnormalities, they're high risk for bleeding. Okay.
Oh, dang.
All right, you can sit up, honey.
Yay.
Okay, do you know where you are?
Yeah.
Where?
In Dad's office.
Okay. Do you know what day it is?
I know it's the 21st.
Okay, good. Do you know who the president is?
Donald Trump.
And then, who's videotaping us?
Jillian.
Okay, so
I mean Jillian.
you're alert and oriented to person, place, and thing. So the next thing we're gonna do is we're gonna test your cranial nerves.
What's that?
No, I'm trying to get. So your cranial nerve. So cranial nerve is we're gonna have a smell. What does it smell like?
Mint.
Yep, good. We're gonna do we'll do a eye test. So
You pointing to what color that is?
So just hold on the eye test. Okay. What letter? Just going to. What letter is that?
It's E.
Okay, what's that one?
Your hand is blocking it. Is it F or P?
Yep. Okay. Now close your right eye. Or cover your right eye. What's that letter?
What letter?
Right up top here.
E?
Yep. How about right there?
P.
Okay, and the next letter?
F.
All right. Now cover your other eye. Can you read that letter?
E.
Next letter?
F.
Next letter?
P.
Okay. Now use both eyes. What's that letter?
E.
Okay.
F.
Okay.
P.
All right. So 20/20 vision. Let's see. Can you open your eyes really big? We're gonna test cranial number 3. Okay. Can you move your eyes upward? Open your eyes big and do upward. Look upward. Okay, look downward. No, don't move your head. Just keep your head straight. Look, open your eyes. Look up with your eyes. There you go. Look down with your eyes. Keep your eyes open though. Good job. So eye movement, can you follow my finger with your eyes? Don't move your head. Good job. All right, can you feel this? We're testing cranial 5. Can you feel the sensation on your face? Can you move your jaw like you're chewing your jaw? Good job. Can you look this way for cranial number 6? Can you move your face muscles, including your eyelids? Make funny faces there. Alright, so that's number 7. For hearing, can you hear this?
Yeah.
How about this? Okay. Alright, can you stand up for me?
Yeah.
We're going to do balance. Can you close your eyes and stand on one foot? Good. How about, can you close your eyes and stand on the other foot? Good. Can you do one foot in front of the other with your eyes closed?
That good?
Yeah.
Mom, I know how you balance. You have to look at something still.
Okay. So the taste on the tongue. Maybe taste. Here, try this.
What?
What's it taste like?
Chapstick.
Okay.
For Dad.
For Dad.
Okay. Can you swallow for me? Okay, good. Let's check in cranial number 10. Cranial number 11, can you shrug your shoulders? Okay.
Like that?
Yep. All right, and then cranial number 12, can you stick out your tongue? Can you move it around? Good job.
Now let me close the door.
All right, sit down. So I'm going to kind of assess your muscles here. The bulk of them are feel good, nice and strong. The tone is great. Can you flex them for me? Ooh, good job. How about this arm?
Yeah.
Good job. We saw your walk. Can you walk for me? Then just stand in place there. Good job. Your gait and stance is normal. Next thing I'm going to do is I'm going to do some sensory testing here. I want you to respond to me here. If you feel this, okay? Is it pokey?
Kinda.
Okay, I'm going to do the same on this side too. Okay. Pokey.
Kinda.
Okay. The next thing I'll do is Is it soft? Can you feel the
A
softness?
little? Yeah, it feels soft.
Okay, how about that? Soft?
You can't feel it because my pants.
Oh, yeah. All right. Can you feel? So I'm gonna kind of
Crap.
vibrate this. You feel that vibrating?
Yeah.
Yeah.
Ow.
You feel vibrating? Good.
Oh, you hurt my leg.
I'm sorry. All right. Okay. So have a seat. We're gonna test your reflexes here. So put your legs out here and dangle them off. Good. 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 All right. How about temperature? Is this cold? You feel the cold?
No. Kinda.
Cold?
Yeah, kinda.
Okay. All right. You can go ahead and that's it. Thank you.
Well, bye, Dr. Mom.